Good afternoon, everyone. My name is Shylettera. I'm a project manager working with the nursing home cohort from Health Insight, and I'd like to welcome you to our half-hour hot topics on infection prevention. These webinars are designed to provide you great ideas on infection prevention strategies in a 30-minute time frame to accommodate your busy schedules. A few housekeeping details before we start. Please let us know who is on the webinar today by entering your name and facility that you represent, as well as the names of any folks joining you if you're listening in a group. Please enter their names in chat as well. Your cameras and microphones are muted. If you'd like to ask a question, please enter it in the chat, and we will facilitate a question and answer session at the end of the presentation. We are excited about today's presenter. We have Linda Egbert. She is a nurse and a certified provider of healthcare quality. She has extensive clinical experience, graduated from Brigham Young University with a BSN and has a master's degree from the University of Utah. She has worked with Health Insight for 5 years with a focus on hospitals and healthcare-associated infections. Now we want to do a sound check. If you're having issues hearing, please let us know. Otherwise, I will now turn things over to Linda.
Hello, everyone. I'm very honored to have the opportunity to speak with you today. And like Shylettera said in the introduction, I have done a lot of work with reducing healthcare-associated infections, and am just very glad to be able to talk about C. difficile and prevention strategies with you. I know this isn't a lot of time. I'm not going to go into tremendous detail, but I have given the project coordinators in each state a list of potential references, resources, etc., if you want to follow up with those afterward. Next slide. Okay, so these are our objectives for today. We're going to look at best practices, and hopefully at the end of this you can find at least one that could be implemented in your facility to help prevent the spread of C. difficile. So I'm not going to spend a lot of time on statistics and information, but just to kind of give a sense of the magnitude of this problem. It caused almost 500,000 infections in 1 year across the United States. And it is considered to be a very important cause of infectious disease death. 29,000 patients died within 30 days of their initial diagnosis with C. difficile, and greater than 80% of those deaths occurred in patients aged 65 and older. So as you can tell, it's very much an issue and a concern for the residents of your nursing homes. Because this is a healthcare-associated infection, it adds a lot to the medical bills, up to $4.8 billion each year in the United States in excess healthcare trying to take care of it. And more than 100,000 infections develop each year among the residents of U.S. nursing homes. So that's kind of where we are with that. I just want to kind of get a sense of where all of you are with your experience with C. difficile infections. So we're going to do a polling question. Jeremy has pulled it up, so go ahead and respond to that, and I'll give you just a few seconds to do that. And while I do that, I'm going to show you my C. difficile bacteria. It's a little I don't know what you'd call it, stuffed animal sort of a thing. And I keep it here in my office because it reminds me that it's continuing to be a big issue. So what have we got from our polling?
We have 82% said yes, 18% said no.
Well, you 18%, you are very fortunate, and my guess would be before the end of the year that you may see it in your facility. Next slide. So that is a picture from CDC of what C. difficile bacteria looks like. Not quite the same as my little stuffed one, but remember that we do, as healthcare providers, have the ability to help prevent the spread of these C. difficile infections. Oops, one too many. But if you're listening in today thinking that there's going to be that magic silver bullet to help control C. difficile infections, there isn't. No single action will be sufficient, but CDC has recommended 6 specific strategies, and those are the ones that I want to go through with you today, all associated with best practices. The first and foremost is to prescribe and use antibiotics carefully. And that certainly is a major concern in all facets of healthcare. You may have heard of the Be Antibiotics Aware campaign from CDC. And they recommend that for every prescription that you get for an antibiotic, there should be an indication or why it has been ordered. One of the things that is common is that patients in nursing homes or residents in nursing homes often will get an antibiotic to treat asymptomatic bacteria. And that's kind of interesting. We just did a series on asymptomatic bacteria here in Utah, and it's a very common practice. But truly, there are no indications for antibiotics under that description. If the patient isn't having symptoms, there's no need for an antibiotic. How long do they intend to have the patient on this? Is it a 4-day course of antibiotics? Is it a 7-day, 12-day? Whatever that would be, should be included in your orders. We also highly recommend using what we're calling an antibiotic timeout at about 48 hours on the infection. Double check that it's still appropriate to keep the patient on antibiotics. For example, quite often you'll have your culture results and sensitivities back by then and can determine if you're doing the appropriate treatment. And of course, we all know about antibiotic stewardship programs, the ability to track and report the usage to care providers to help them monitor their use as well. Next slide. Now, as Shylettera said, I've spent most of my career in hospitals, and as we were starting to recognize C. difficile, we sure sent a lot of stool cultures, a lot of stool cultures. If the appropriate recommendation is if the resident has not had 3 or more unformed stool within 24 hours, there is no indication that we need to do a testing for C. difficile. And it's also interesting, I heard a story about someone they had sent some testing for C. difficile because this individual was having diarrhea. Well, as it turned out, she'd been getting laxatives on a routine basis, not an indication for doing a test. How do you know if you've got an appropriate specimen? It should conform to the shape of the container. There should not be any form to it. It's liquid, conforms to your container. Most labs anymore use the PCR assay, although you may have other ones that you use as well. And you can find that out from your laboratory folks. And just a comment, because I believe this will be more common for you folks in the long-term care. If it's going to be more than 2 hours before that specimen gets tested, it does need to be refrigerated. Okay, so that's all kind of the preparatory. Let's try and not get to this point. But if you have a resident that you are thinking has a suspected C. difficile infection, you should implement contact precautions for that individual as soon as you recognize that. That includes any direct or indirect contact with the resident or their environment. So even just like walking into a patient or a resident room, if you're going to do anything, turn on the light, anything, you should use your contact precautions. Okay, now this is a recommendation, I know. The recommendation is that there is a single resident room with a private bathroom. Now, realistically, I know that's not common in the nursing homes, at least in the state of Utah, and my guess is that's not too different. If you can't give them their own private room with a private bathroom, you can do some cohorting of, let's just say you have 2 patients with CDI, those would be good residents to have in the same room. And this does include both gowns and gloves. If you have your residents going into common areas, one of the most important things is that you do assess their bowel continence and their personal hygiene. If this is someone who has real problems with incontinence and containing that stool, probably not a good idea to get them into the common areas. But if they're relatively continent or it can be contained, say in a brief or something like that, it's fine to let them come into the common areas, but make sure you put a clean gown over their clothing. That helps to prevent it from being spread in the environment. Okay, next slide. The hygiene issues, hand hygiene, soap and water is preferred for any patient with a suspected C. difficile infection, rather than the alcohol-based sanitizers. And the reason for that is alcohol will not kill the C. difficile spores. So soap and water, vigorous hand washing is the best option. Also, you need to encourage your patients, residents, visitors to do the same thing, hand hygiene, and also to perform contact precautions. It's fine to use briefs or pads, just keep them contained. And there's no need for special handling of their clothing, bedding, towels, dishes, utensils. You can just wash them in the normal manner. Environmental cleaning and disinfection, this is probably one of the most common things that I get lots and lots of questions about. Because environmental cleaning is an important strategy. For suspected C. difficile infection, a 10% bleach solution is a recommended agent for cleaning. It should be maintained for 1 minute and allowed to air dry. And just so you know, the spores can exist on surfaces for up to 5 months. That's a long time for these spores to be around. So paying attention to that and using your bleach cleaning solutions is a great idea. For daily cleaning, the floors, the bathrooms, the beds, the furniture, and all high-touch surfaces, which might include, say, a telephone or a call light or light switches. Those should always be done every day in a room where a resident has C. difficile. And I'm not sure how you guys manage your terminal cleaning because your patients are a longer term resident in your facility. But once that individual is no longer in the room or has been cleared of their C. difficile infection, you do need to do what we call a terminal cleaning, which again is very similar to the daily, but even more involved. Again, you should look at every surface that resident has come in contact with, as well as any other furniture, etc., and any of the equipment that you have left in the room, such as stethoscopes, blood pressure cuffs, any of those kind of things. Next. And last but not least, if you are moving your resident around, say sending them to the hospital, sending them for x-rays, something of that nature, make sure that the place that you are sending them knows that this resident has a suspected or a confirmed C. difficile infection, so that they can also utilize appropriate contact precautions. If you use transfer communication forms, that's a great idea and a good place to, again, identify what type of precautions are necessary. It's amazing to me as we talk to folks in transport vans, ambulances, quite often they are not aware that the patient has this type of infection, and they would need to go through the same contact precautions and cleaning mechanisms in order to not spread that to the next resident patient person who winds up in their transport van. It's also very important to do some teaching with the resident family and visitors so that people understand what this is about and why we go through this whole process of the contact precautions, etc. And actually, CDC has some really nice patient education materials on C. difficile, and again, your state liaison can help you out with that. Next. Okay, I know that was quick. I know we ran through it fast, but which of these 6 strategies that we just identified do you think might be beneficial to you as you continue to work on improving your CDI prevention work? And feel free to mark as many of these as are applicable or that you think is an area where you can do some work. So go ahead and enter your polling. I'll give you just a couple of minutes to get it all entered. Oh, we're still having voting. Okay. Well, it looks like somebody can use every single one of those strategies in their prevention efforts. And, you know, I really like these strategies because they do seem to be very practical, very realistic ways that you can utilize them. And of course, if you want to have more information on any one of those or whatever, you can let your state contact know that, and perhaps there can be some follow-up or other educational offerings for you. Anytime you're working on improving in your facilities, just know that a lot of the routine tools that you already use are very helpful as you're looking at C. difficile infections. So for example, checklists. And there are examples of checklists for terminal cleaning, checklists for day-to-day cleaning, checklists for hand hygiene observation, all of those kind of things. Certainly doing education and competency testing. I was very interested. Somebody had posted something in APIC saying that they actually are having people go through a competency of dressing in the personal protective equipment for contact precautions. And they were finding that there was some area for improvement in the way people were removing gloves. If you've ever used value mapping or gap analysis, those are also tools that can help you identify how are we going to get these things implemented from where we are right now and understanding the challenges and limitations to where we want to be. And I will also highly recommend, if you do get a resident who has a C. difficile infection, go through an RCA or a failure modes effect analysis on that case. It can help you identify where, again, some of your challenges can be in the spread of this.
Okay, thank you so much, Linda. Shannon, do we have any questions for Linda in the chat at this time? If you do have questions for Linda, this would be a good time to go ahead and put those in the chat. While Shannon is looking at those comments in the chat, just want to remind you to visit us online at these links. Specifically this one, this will take you to all of our nursing home resources that are available. Shannon, are you ready?
I am. We haven't had a question just yet, although folks can still enter those in. Brent asked if Linda could please review the last or show the last polling results once again.
Those are up now.
Great.
While we're waiting, let's see if we can maneuver this to work. I'll actually take you to our website here if it'll pull up for us, and I'll show you where to find those resources. This presentation, along with the others we've had, will be available on this website as well.
And just while Shylettera's pulling that up, CDC really does have some great informational things. One thing I like to recommend specifically is they have an infographic that very briefly, one page, talks about transmission, ways to contain, etc. And again, I've provided that link to your state representatives. So it's a great thing without having to go into a lot of detail to communicate exactly the challenges associated with C. difficile.
Okay, so here on the screen now is, well, all of our resources are listed here, but when you click on the link that is posted in the slides here, it'll take you directly to this section on infection control where you can see tools from ARC, a tool that Oregon is using, and a specific training session on antibiotic stewardship. So please, if you have trouble getting to these, please reach out to your state lead, but a lot of nursing facilities that have utilized these opportunities have found them helpful.
So we did have a question from Amber, who is asking folks to comment. She said, we were not putting a gown on residents when leaving the room to go to therapy. Is everyone else?
So that's not really a question for me. That's a question for the participants. And is it best, Shannon, to have them answer that in chat, or?
Sure. If folks want to put their comments into chat, or if Linda, if you want to give any further recommendations around that practice.
Well, the reason that recommendation is given to use a gown, whether they're going to therapy or, you know, the common rooms, wherever they're going, is because C. difficile spores are so universal in the environment when someone has that infection. So putting a gown over their clothing helps to contain any of those spores so it doesn't continue to get spread into your therapy areas or common rooms or whatever. So that's why there is that recommendation.
Okay.
Anything else at this time from anyone?
I don't see any additional questions in chat. Let's see. Oh, Deborah commented, what type of gown are we talking about?
It doesn't have to be one of your isolation gowns necessarily. If you have like hospital gowns, you know, those that open in the back, put one on front ways and put one on back ways. It's just something that has gone through your laundry process, because the laundry process will kill the spores. So it doesn't have to be anything special. You can certainly use your personal protective equipment gowns if that's easiest for you.
And then Lynn commented and asks, can it be a gown that the resident owns?
I guess it could be, but it should, again, go through the specific laundry process. I would not recommend that people, you know, have one gown that they keep hanging in the closet and use it day after day, time after time. It ought to be something that can be washed in between uses by the resident. Again, you're just looking for ways to keep those spores from spreading to other parts of the environment.
Okay.
Okay, well, thanks so much for your time this afternoon. If you could please check the chat, you will see a link for an evaluation. This presentation will be posted on our website in a few weeks, and so we encourage you to check it out and all the other webinars that we've had, and that link will be posted in the chat as well so that you can share this with your colleagues that could not attend. You're welcome to join us on July 17th, a Tuesday in July, for our next Hot Topic session, which will be presented by the Utah Department of Health, and we will discuss what you must do or what you should do in the event of a C. diff outbreak. So please look to join us for that.
And Shylettera, we did have one more comment from Melinda saying, so what is being referred to is that a clean gown should be put on patients prior to transport.
Right, before they leave their room.
Great.
Thanks so much, Shannon. If you have any questions, or if you have, especially about any specific resources that Linda mentioned today, please reach out to your state leads, and we are happy to contact Linda to get you anything that you may be in need of in regards to the details she went through today. And again, please help us with those evaluations. And we want to thank Linda for her expertise and being so willing to share with us. She's a great resource here at Health Insight. So we were very fortunate to have her present. And again, we thank you for your time and commitment to improve the quality of care for nursing home residents. Thank you.